With the expiry of the patent for the drug combination used in Truvada, a number of generic versions of tenofovir disoproxil fumarate and emtricitabine were approved by Health Canada. That's meant more options for the drugs to cover PrEP and reduced prices both for consumers and for public and private insurance plans. The introduction of multiple generics onto the market has meant the out-of-pocket costs and the amounts that public and private drug plans pay for PrEP is greatly reduced. So prior to the introduction of generics, only the name brand drug Truvada was available for use as PrEP, and it cost roughly $1,000 a month in Canada. Now some of the generics are available for out-of-pocket payers for as little as $250 a month. Both private insurers and public plans have been benefiting from the reduced costs related to these drugs. More and more private insurers are providing PrEP, and we've seen provincial drug plans start to offer PrEP as well. In September of 2017, PrEP became available through the Ontario Drug Benefit Plan, and the province of British Columbia has recently started making PrEP available to some people at high risk for HIV as well. Canadians still lack access to one unified drug plan that provides universal access across the country. Individual patients are forced to navigate different federal, provincial, and private drug plans in order to figure out what access is available to them. There's different routes that individual patients can take to try to figure out what their access options are. So one is talking to a pharmacist and asking if they can see what coverage you have through the plans that you have access to. For folks who aren't sure what their coverage is or interested in securing coverage that'll provide them PrEP, they can talk to a social worker or to staff at a local community-based HIV agency. So I'm the provincial coordinator for the Ontario PrEP Cohort Study. We're going to be enrolling 1,250 people using PrEP from 12 clinics across the province to find out more about their health outcomes using PrEP, their experiences with PrEP, and whether they faced any barriers accessing PrEP. We're hoping that the information that we glean from this study will help support outreach and education efforts related to PrEP and also improving delivery of PrEP services across the province. If you're interested in getting involved in the study, you can link up with one of our providers, or you can connect with me and I can help link you up with them personally. We'll also be holding education and outreach events, both as we're enrolling patients and as data is coming out of the project, so that our results make their way back to the communities that need them.